Hormone imbalances cause many symptoms like moodiness, irritability, but did you know that hormone levels can also affect your chances of getting breast cancer? Here with more is Dr. Clark Hansen from the Hansen Clinic of Natural Medicine. It's good to see you, Dr. Hansen.
See you.
We want to first talk about patients that you've been seeing.
Right.
You know, a lot of people sit out here and they watch these segments, but they want to know, how can it help me? And you want to kind of talk about somebody who came in.
That's why I'm a physician. It makes such a difference in people's lives. They just are so thrilled to find there's answers. They get their lives back by getting their hormones in balance. I want to share some stories so you know a live patient, what their background is. So I had a patient who was 52 years old, came in to see me. Her main complaint was, and we got a whole list of her chief complaints you can see, was her moodiness. First of all, she just didn't know herself anymore. She was irritable and having kind of ups and down, tired and irritable and depressed. Hot flashes, of course. But she also had heartburn, bloating, hypothyroidism. She'd been on thyroid medication since age 21.
Oh, my.
And hypoadrenia. That means low adrenal function, which relates to thyroid as well. And that causes hypoglycemia. So she had all these symptoms. So what do we do with someone like this? So we look at, number one, her history. She'd had a hysterectomy 4 years prior to that. So at age 48, she had a hysterectomy because she had endometriosis. Both of those are signs of too much estradiol, the bad estrogen, and not enough progesterone. That's really the key to breast cancer. That is the cause of breast cancer. Too much estradiol, not enough progesterone.
Okay.
So this is Breast Cancer Awareness Month. We should let everybody know the most important thing you can learn about breast cancer awareness is check your hormones. More than a mammogram, you need to know your hormone levels every year and that ratio, that balance between those two.
Well, how do you know if your hormones are out of balance?
Well, you need to get a test. You can, symptoms are going to give you lots of clues. So if you're feeling the symptoms of PMS, irritability, moodiness, breast tenderness, that's too little progesterone. It's also too much estrogen. So leading up to menopause, those are the symptoms. After menopause, hot flashes, vaginal dryness, those are the symptoms of too little estradiol. But you've got this balance that's most important. So you have to do a blood test to find out.
Okay, so your patient went through all that, and what's happening with her now?
So we tested her hormone levels. We got a chart to show you her levels because this really points out some important. Because she'd had a hysterectomy, she was given estrogens, and she was given the wrong one, estradiol. That didn't get rid of her hot flashes, so then they went to the pellets, which are surgical implants. You can see here estradiol, that first level there, should only be 8 to 28, and her level was 321 the first time I saw her. And that was 3 months after she had had her last pellet injected.
Couldn't that be dangerous?
Yeah, that's dangerous. It's too high, and it just keeps going. So in the patient's progress, we saw that come down, but it took about 6 months to finally get down to that 132. It's still too high, and at her third testing. So we're also, the estriol you see is the next one. That's the actual hormone that prevents cancer, and it started out too low at 37. We got it up to 94.
So they were completely off balance.
Opposite. Yes. And then one more time, we should look at that screen one more time. Progesterone, that's the other key. It was also too low, and it had never been treated. She'd never been given any progesterone, and it was too low at 10. We finally got it up to 200. It should be between 100 and 200.
So she was probably thinking, I'm on replacement or bioidentical hormones, so everything should be fine, but they were all off.
Exactly.
Okay, so very important.
So she got treated with the wrong ones, never given progesterone, and that's often missed in a woman's analysis and her treatment. And that's the one that is actually the anti-anxiety hormone that reduces the irritability. Testosterone helps with preventing depression, increasing sex drive. Also helps maintain muscle integrity. Estrogen you need for preventing the hot flashes, but do not get estradiol. That's one we all die from.
Yeah,
we
remember
don't
with
want
the
that.
D. That's good to know.
Yeah.
Dr. Hansen, I know there's people watching right now who want to do this. Is there a better way to take these bioidentical hormones? Is there what would be the best method?
Well, the best way to take it is a sublingual pill. So you actually, we have a capsule that you pull apart and pour it underneath your tongue. And show a slide of the 4 different types of delivery systems that you can get. The pellets that are surgically implanted, that's a surgery that has estradiol in it. You don't want that one. That's harmful long term. Oral pills, it's a waste of money. They just have very minimal effects. They don't work when you swallow them. The creams, they're messy, they don't absorb well, and they're good for short term, but they don't work long term.
Yeah.
So the best way is a sublingual. It gets absorbed in the mouth, so it goes to the bloodstream right away before it goes to the liver to be broken down.
Gotcha.
And that produces the highest absorption, the best results. And then you can give the estriol, excuse me. That estrogen is the safe one. that actually prevents cancer, prevents the hot flashes, prevents thinning of the bones, thinning of the skin, thinning of the vaginal membranes. This patient of mine, after 6 months, well, actually within a few weeks, she was feeling better in her mood.
Wow.
No more night sweats. After 6 months, her thyroid, we also treated her thyroid with natural thyroid rather than synthetic. And after, 20 years of being on, actually 30 years of being on synthetic hormones, she still had a swollen thyroid that went away on the natural thyroid.
That's amazing.
Women just need to know there's natural alternatives that work better than the drugs.
Absolutely.
And you can feel great again and get your life back.
Well, I know we want to mention the special offer real quick because people are watching and they want to feel better like this patient did.
Right. So go to my website, drhansen.com, sign up for the newsletter. At the newsletter, when you get the newsletter, you also get a $50 gift certificate just for watching the show and signing up.
Okay.
And we'll enter your name into a drawing for a free hormone test to test all 5 of the key hormones women should be testing.
Very important. So even if you're on something, you should still get a test because it may be all off like this
You
patient.
just never know.
Thanks, Dr. Hansen.
Right,
Really good information. So if you want more, of course, on Dr. Hansen, super easy. Go to drhansen.com. Can't get any easier than that. Or you can call the number you see right there on your screen.